Hi everyone, I'm Dr. Jane Yu, board certified dermatologist and Mohs surgeon. Today I want to talk about how to layer skincare products and active ingredients safely and correctly, because layering can either improve your results or lead to irritation if it's done incorrectly, and that can be disastrous. The first principle of layering is order. As a general rule, products should be applied from lightest to heaviest texture, because this allows each product to absorb properly without blocking the ones that come after it. A simple framework to think about this is cleanse, prep, treat, moisturize, and protect. After cleansing, hydrating toners or essences come next. These help prep the skin and support hydration, but usually do not contain any strong actives. Treatment serums, which include most active ingredients, come after that. Moisturizer then follows to support the skin barrier and lock everything in. And in the morning, sunscreen is always the final step. When it comes to active ingredients, timing as well as combinations matter. Vitamin C is a common daytime active. It works as an antioxidant, meaning that it helps neutralize free radicals generated by UV exposure and pollution throughout the day. Using vitamin C in the morning helps support the skin's natural defense against environmental stress while improving brightness and uneven skin tone. Vitamin C is typically applied after cleansing and before moisturizer and sunscreen, so it can interact directly with the skin. Retinoids, including retinol and prescription retinoids, are best used at night. Retinoids increase cell turnover and stimulate collagen production, but they can also make the skin more sensitive to sunlight and are less stable when exposed to UV. So using retinoids at night allows them to work uninterrupted while the skin is in its natural repair mode. Retinoids should be applied to clean, dry skin and followed with the moisturizer. If you're new to retinoids, start using it 2 to 3 nights per week and gradually increase their frequency so it can help minimize irritation. Also, some ingredients work well together while others are better separated. Retinoids generally pair well with barrier-supporting ingredients like ceramides, peptides, and hyaluronic acid, which help counteract dryness and irritation. However, layering retinoids with exfoliating acids such as AHAs or BHAs in the same routine can increase the risk of irritation, redness, and barrier disruption. AHAs like glycolic or lactic acid exfoliate the surface of the skin and are often used to improve texture and brightness. BHAs like salicylic acid penetrate into pores and are commonly used for acne-prone or oily skin. Because both AHAs and BHAs increase exfoliation and skin sensitivity, they are often best used on separate nights from retinoids rather than layered together in the same routine. If you're introducing a new active, buffering can also be helpful. This means applying moisturizer either before or immediately after the active to reduce potential irritation. This approach is especially useful when starting retinoids or chemical exfoliants. Finally, keep in mind that more is not always better. Using too many actives at once can overwhelm the skin and disrupt the barrier. A consistent, simplified routine that you can maintain is often more effective than a complicated one. Layering actives correctly is about understanding what each ingredient does, when it's best used, and how your skin responds. If you're unsure how to combine products or you're experiencing irritation, it's always a good idea to review your routine with a dermatologist.